According to the American Society of Addiction Medicine, the leading cause of accidental deaths in 2014 was drug overdose. The number of lethal drug overdoses in 2014 was 47,055. Out of those 47,000 deaths, 18,893 of them are from opioid overdose, and 10,574 of them are from heroin overdose. These numbers have only increased in the last 2 years. The triplex formed by Southeast Kentucky, Southwest Virginia, and Northeast Tennessee ranks third in the nation for opioid addiction and just under Miami and Los Angeles. Clearly, this is a large problem based in the United States, but how can we combat these ever-climbing numbers? In recent years, Suboxone clinics have begun to fight back against this issue. The clinics use the medication Suboxone to help addicts of both opioids and heroin relive their lives, but this time without their addiction. This sounds like a great thing, right? Doctors across the country helping individuals suffering from addiction to go back to a normal life? What people do not realize is how Suboxone is different from the alternatives to addiction recovery. When an addict decides they want to turn their lives around, they have a few options: quit cold turkey, visit rehab, or go to a Suboxone clinic. Of these options, Suboxone clinics are the better option for individuals that are wanting to end their addiction without putting their life on hold. Once an addict has chosen their respective form of recovery, if they choose Suboxone, they then choose their clinic. Visiting a Suboxone clinic is the same as any other doctor's appointment. There is the long, awkward silence in the waiting room, finally getting called into a patient room just to sit there for a little bit longer before the doctor comes in. But then the visit changes. The doctor comes in and talks about how the patient's doing, how they're handling their addiction, how life's going in general, and the progress that the addict feels that they made, how that's going. The doctor cares about what is going on in your life. These clinics connect to the patients and have a personal stake in each addict's recovery. The addicts have chosen this clinic just the same as they would their family doctor, because they trust them. Suboxone is better than the alternative for the simple fact that addicts desiring to continue on with their lives can do so without putting everything else on hold. The Suboxone pill is taken as part of your daily routine. It is taken as prescribed like any other medication. If only one dose is necessary, then it's taken with your daily vitamins. Suboxone also helps individuals integrate into society easier since the drug blocks the receptors in the brain desiring the opiates or heroin. Addicts can go about their day without worrying about where they will get their next fix. Another important thing is in rehab and Suboxone clinics alike, addicts go through a number of steps to get their lives back on track. However, with Suboxone clinics, they can begin making this progress as they go, instead of waiting to get out of their treatment. The main argument against Suboxone clinics is that it's just another drug. Why prescribe them a drug when they are already addicted to drugs? Suboxone clinics do not just prescribe patients drugs and move on to the next. They sit down, provide counseling surrounding their addiction. Many, if not all, clinics require and offer a monthly Narcotics Anonymous meeting. Another common concern surrounding Suboxone is that it can be just as addictive. Any drug has the potential to be addictive if it is used incorrectly. However, Suboxone is made to be a transitional object, an object that helps aid in the transition from dependence to independence by blocking the receptors craving the drugs. This is why, as a patient's treatment progresses, the dosage of Suboxone is lowered. To conclude, Suboxone clinics are one of the many ways addicts are coping and ending their addictions. Addicts choose Suboxone because they can still be treated as individuals. They can move on with their lives, and although there are issues surrounding these clinics, they are doing more good than people realize. Just remember that addicts are people too, and they need the best care available to them. Thank you.